Well, good morning. I first want to start off by thanking Chairman Kevin Brady and Chairman Greg Walden and their members of their committees. This is the first phase in a three-phase process. The Energy and Commerce Committee marked up more than 27 hours. The Ways and Means Committee, 18 hours. That's collectively 45 hours of debate and deliberation. This is regular order. This is the committee and our members at work, just what the American people expected from their representatives. The work will continue next week under the leadership of Chairwoman Diane Black and the Budget Committee. I want to put this work in perspective. Obamacare is failing, and we cannot do nothing. It would cause more harm and hurt for the American people. Additionally, repealing this law without the replace policies that these committees and conference have worked on would be just as damaging. As I've said, this is step one in a three-phase step. So I first would bring up Chairman Greg Walden.
Well, thank you, Leader. Appreciate it. It's great to have the markup behind us. I think our committee did incredibly important and good work. We had an open process where everybody that had amendments could offer them and did so, and we came to, I think, a very good work product at the end. Look, this is major entitlement reform. We're going to restore power to the states. We're really committed to fixing this individual insurance market. As the leader said, this is just the first step, though. This has to be looked at not in isolation, but across the board with what Dr. Price can do at HHS, what we will do legislatively going forward in the traditional legislative process outside of reconciliation. This is going to take time to get all those other pieces in place, but we are committed to reforming this. And we're going to go after the cost drivers as well. You can't just fix that in reconciliation. We have to look at what's driving the costs, what's behind that, and I guarantee you the Energy and Commerce Committee is going to do that because we represent patients who say, why does all this cost so much? And we want to get back to that patient-doctor relationship and squeeze the waste, fraud, abuse, and high costs out of the system, and that's also on our list going forward. So I'm delighted we were able to complete our work product. We may have set a record in terms of consecutive markup time. The Ways and Means Committee is a little more efficient. They got it done a little quicker, but they have fewer members. But now we're proud to hand our product off to the Budget Committee and under the great leadership of Chairwoman Black, and then it'll go up to Rules and we'll get it on the floor. So with that, I'll turn it over to the Chairman of the Ways and Means Committee, Mr. Brady.
Thank you. Chairman, thank you for your good work. Together, we took historic action this week to repeal Obamacare and lay a thoughtful foundation for the patient-centered health care system House Republicans proposed more than 8 months ago. After 7 long years, and more than 200 hearings, hundreds of proposals, and this week, 2 all-nighters, House Republicans successfully moved forward in our promise to dismantle Obamacare's crushing taxes and mandates and begin to return control to the states and return power to individuals so they can pick plans that are right for them, not Washington. President Trump called on Congress to save Americans from Obamacare, and this week, House Republicans continue to deliver on that promise. Our solution includes reforms long championed by conservatives, including tax credits, expanded health savings accounts, and by doing this, returning control to the states so they can design health care that's right for their communities, recognizing there is a difference between Manhattan, Kansas, and Manhattan, New York. These policies include a strong reform to allow the free market to restore itself and give people control over their health care again. But we're not stopping here. This is just the beginning of our work. I look forward to continuing to work with my colleagues in Congress and the Trump administration to rebuild our broken health care system for people in Texas and across the country. And I'm very pleased to be able, along with Chairman Greg Walden, to be handing these reforms and these solutions to the chairman of the Budget Committee, Ms. Diane Black of Tennessee. Chairman?
I thank both of you for handing off this wonderful piece of legislation and giving me an opportunity to work with my Budget Committee members. And this is an exciting moment for our party and for our country. And we've promised that we would repeal and replace Obamacare with a patient-centered health care system that reduces costs. And we're one step closer to keeping our promise. This bill secures key conservative victories. It dismantles Obamacare's mandates and taxes, as has already been said. It puts healthcare decisions back in the hands of patients where they belong. And as a nurse and someone who's been in the healthcare arena for a long time, this is where it belonged all along. It protects the most vulnerable Americans, and I applaud the leadership of both Chairman Walden and Chairman Brady for their tireless work on this legislation. I also applaud our leadership, Speaker Ryan, not only this year but in previous years, for producing the Better Way plan that is the basis for our repeal and replace legislation. The Budget Committee is ready to take up this legislation and to continue to review our bold solutions to reform our healthcare system and hopefully move it to the full House for consideration. Some have said that this legislation doesn't do enough. On the policy side, this legislation is basically the same bill that we passed in 2015, supported by all 3 Republican members, and adds replace provisions to ensure that no Americans are thrown off of their current insurance plans. It zeroes out the mandate, it repeals the taxes, it repeals the subsidies, and it rolls back some of the regulations. And if you want to repeal Obamacare, this bill does it. Procedurally, because we are using the reconciliation process, there are certain things we cannot do in this bill. But my friend and former colleague Tom Price will play a large role in further addressing these aspects of the current healthcare system in his role as the Secretary of Health and Human Services. We also look forward to addressing more of the regulatory regime enacted by Obamacare down the road through the regular order, and we hope that our colleagues on the other side of the aisle, the Democrats, will join us in this effort. It is the right thing to do.
Questions? Yes.
Mr. McCarthy, conservatives who meet with leadership here come out saying their impression is you're offering them a take-it-or-leave-it reconciliation bill. Conservatives who meet at the White House come out saying they seem open to talking, including particularly in moving up the Medicaid freeze to 2018. So my multi-part question is, are you up here on the Hill open to changing reconciliation before it gets to the floor? If so, what changes, and might they include moving up the Medicaid freeze? And are you guys out of the loop with whatever talks are happening down at the White House?
I don't see how we're out of the loop when we're down at the White House. Later today, you will see these two, a number of chairmen going down to speak with the president as well. No, as we worked through it, they took a number of looking at different amendments and debates. Remember, this is 3 phases. I think that brings some people concerns about how they want to do this. Some people talk about wanting to repeal and then go forward. You'd have to get 60 votes moving forward. That would be a very difficult thing to do, and I believe that bill would not be as conservative as this bill to solve the problem that we need to solve. So as we work through in the 3 phases, that's why we continue to talk. But we have been working at this for a number of years. When we put out the Better Way, we had everybody inside the conference to give their opinion and others. Just in February alone, there were 7 different meetings for those to come forward and talk about the idea. That's why the culmination of this is input from everybody inside this conference and across the country having input.
Are you open to moving up the Medicaid freeze date?
I think right now that'd be very difficult to do. We had the discussion. If you want to bring up from your committee perspective, you had the debate inside?
Yeah, I mean, we appreciate that. What we want to make sure is that we don't create any gaps here for people as we give power back to the states, as we go to a per capita Medicaid system, as we repeal Obamacare. We want to make sure that we don't create gaps, that the insurance market can get the reforms in place. We can save it from collapse, get the tax credits there as well. So I've had discussions all along about different dates, different timelines, the governors, with insurance commissioners, with leaders of each of these different groups. By the way, we had a unanimous vote on the Republican side coming out of the committee. 2 of those members are in the Freedom Caucus. 2/3 of our members are in the Republican Study Committee. So the members that know this policy the best, who have been there the most every day as we've worked through it, realize and came to support the bill that we passed out and sent now up to the Budget Committee.
Can I follow up on that very quickly? You said it would be a difficult discussion to have. Is it because specifically there would be a gap in some sort of coverage if you phased out the Medicaid expansion sooner?
What we want to make sure is that we don't create a gap. Obviously, how all this comes together varies state by state. Because remember, you have some states in the expansion, some states not in the expansion. Some states meet once every 2 years in their legislatures for 40 days. I think Wyoming used to be renowned for that. Other states, their legislatures never in. So we've tried to find a blend. Obviously, it's going to affect different people different ways in different states. But our best effort is what you see before us.
Chairman Walden, if you walk into the White House today and the president says this needs to change, this needs to sunset in 2017 and not 2020, how do you respond to that?
Well, first of all, I look forward to meeting with the president. We've been in regular contact with his team on these issues for a period of time here as we've worked through this. Dr. Price knows exactly what is possible, what's not possible, and the various ramifications of change. We look forward to the president's direct involvement. Yeah.
Yeah, when I talk to people at Heritage, I hear what your constituents probably see when they go online. And that is, all you guys have to do is pass the reconciliation bill that killed Obamacare in 2015, was passed by the House and the Senate. How would you respond to that?
Well, that is our base bill. That's where we started. And now we have the opportunity to do even more. To say we just repealed ignores the entitlement reform opportunity that we've passed now unanimously out of the House Energy and Commerce Committee and out of the Ways and Means Committee that actually restores power to the states, that puts Medicaid on a real budget. And this is a step forward in the conservative cause to get the Washington bureaucracy out of the middle of all the decision making on Medicaid. So they should be embracing what we're doing as we go forward.
And if you responsible for them to suggest
You
this?
talked a little bit about the attacking cost drivers eventually. Can you go into that?
You'll see us move forward on a number of initiatives as we look at the whole cost pool. I remember when we did reform of Oregon's workers' comp system. We started with what's best for the worker/patient, and we had one of the most expensive systems that produced some of the leanest benefits for injured workers in the country. Employers were upset, workers were upset. When we got done looking at the cost drivers in the middle, cleaning all that out, we got to a system that had some of the best payments to injured workers, and premiums came down for their employers. I think there's a lot of room in the middle of this bureaucracy of healthcare to get at cost drivers, and our Energy and Commerce Committee is going to begin taking up those issues, and it's all across the spectrum. This is going to be across the spectrum, because if you're a patient in Hood River, Oregon, you're wondering why things cost what they do, because a lot of times it doesn't add up. And so I was out at Oregon Health Sciences University last Friday, and they told me the new injector for naloxone has gone up 9-fold in the last few months. It's another EpiPen-like deal. We're going to get into it. But if it costs $5,600 to save a patient's life who's dying from opioid abuse, something's gone wrong.
This may be a question for Mr. McCarthy, but since you're headed to the White House later, Mr. Chairman, I'll ask you this. Is there any chance that what is cleared your committee, what's cleared Ways and Means Committee, can look any different when it goes to the floor later?
Look, we're in a legislative process. We've got the House, we've got the Senate, the Budget Committee. Their members are empowered with voting cards like our members are, the Rules Committee, and the House floor, and then over to the Senate. So I'm not going to predict what the president's going to tell me. I haven't met with him on this topic. I'm not going to predict what these other committees are going to do. They've given us the flexibility as the people most focused on the policy to put all our brain power and effort and time and energy into getting to the best policy we figured we could get to. And so that's where we're at today.
Let's remember this. We just walked through 2 committees. Every single Republican on both committees voted for the bill.
Yep.
I think you're playing into a little more. This is a legislative process. This is 3 phases. As we continue to talk to individuals, there are other times to do pieces of legislation as we move forward. And we will do other pieces of legislation. But the one thing in the question earlier, when you talked about if you just wanted to repeal it, if you just repealed the bill, you would double your premiums and you would collapse the market. Then you're going to sit here and wait and hope you get 60 votes to try to deal with the healthcare system. I do not believe that's the best approach. That's why we are repealing and replacing. Because of the system that we are in and the rules of the Senate, we have to do it through reconciliation. So we have to deal with the Byrd rule. So there's not everything that we would like to have in the very first phase could be in the bill. But as we continue to talk to everyone, we're going through 3 different phases. Do not underestimate the power of the HHS secretary. In the ACA, there's 1,400 points in that bill of shells that gave the secretary power. At the same time, administratively, they will be doing the work to sustain the market. When you talk to those about whether they'd come back into market because so many people are leaving, remember, you had 23 co-ops created in the ACA, 18 of them have collapsed after giving more than $2 billion. You have 3,000 counties roughly in America. 1/3 of those now only have one provider. The chairwoman of the Budget Committee, Humana, just pulled out, announced, they have 16 counties in Tennessee that have no provider. The work that Chairman Walden has done when it deals with Medicaid, we did not do that in a vacuum. We brought together governors. We brought governors who have expanded and governors who did not expand and worked together to find common ground. So yes, there's going to be questions on both sides of the aisle. But sometimes when you have pushback on one side and the other side from a political spectrum, you might have found the sweet spot. And it's not easy walking through legislation, but I give these 3 chairs a great deal of credit. The first 2 have just gone through some of the longest markups you've ever seen. Never shutting anybody down, letting the debate go on, and we have a broad spectrum inside our conference, and everybody in that committee, a Republican, voted for it. Let's remember where we currently are in this phase.
Mr. Leader, just to follow up on that, the speaker yesterday suggested that.
I thought that was a very good PowerPoint presentation too, by the way. My wife texted me and said, Paul is doing an excellent job.
In his interview with Sean Hannity, he suggested that there could be regular order legislation moving right alongside the reconciliation bill. Is that in fact the plan, and what do you expect to be in that bill?
That is the plan. And remember, we're expecting the CBO score to come through. You would like to have the CBO score before we talk about where we're going. And at the same time the CBO was going through scoring this, other committees were working, but Energy and Commerce still has work to do. They're waiting for some of the scores to come through. But there's other pieces of legislation that, yes, we will move during the 3rd phase, and some of that phase can start during the week that we bring this to the floor and right after that week.
Like it will be on the floor at the same time as the reconciliation bill, or in the same week?
Some bills can be on in the same week, and some bills won't be prepared yet, and some bills will be after.
Last question.
Is it unhelpful that conservatives are going to the White House and saying, well, why don't we put more stuff in the reconciliation bill that could be burdened out and just go around the
I never find it unhelpful that members express themselves. I never find it unhelpful. Let's remember where we are. President Trump endorses this bill. President Trump wants this bill to pass. Why shouldn't the president communicate and listen to members? And if we're going through 3 different phases, why wouldn't you continue to listen to them? Why wouldn't we continue to work together? I think that's a good form of government of the way of the process that we're doing. We have an open process. And if we're going through 3 different phases, in that 3rd phase, we can bring up and pass that piece of legislation that other members can feel that it gives them greater support to pass for this one.
But what do you think about that idea of going around the parliamentarian?
I'm sorry, what did you say?
What do you think about that idea, though, about going around the parliamentarian?
That's a Senate question. I would wish that we're still dealing with a Budget Act of 1974. I would love the idea that we could repeal and replace exactly how we would want it. It is unfortunate that in the House, we are being contained with all of our ideas based upon a Senate rule and a Byrd rule. I think that's a frustrating part, but we know where we are, and we're not going to sit back because Obamacare is failing. How many more counties have to open up the next day and find that someone has pulled out? Aetna's CEO said it's a death spiral. We've been studying this for 7 years. We've had more than 113 hearings in the past Congresses. We have put before the voters in a better way of what we would do with Obamacare, replacing it. Now is time to act, and that's exactly what these committees did, and that's exactly what the Budget Committee will do next week. Thank you very much. There you go.